types of treatment are offered for myeloma patients?
Right. So if you think about, at the point where a patient is diagnosed with myeloma, unfortunately, always a tough, always tough news to receive and to share with patients as well. We start to think about dividing treatment into phases. And in part, some of it's going to depend on, what is the fitness level of a patient in front of me? And not so much age per se, but really fitness level. And what I mean by that is, independence in their activities of daily living, their ability to walk, go up a flight of stairs, carry out, just their daily life. So assuming that all options are on the table, we consider those patients to sort of be what we call stem cell transplant eligible. And that picks, a sort of a variety of pathways that we can go down. And then the other variety of pathways we can go down are patients where either because of, comorbid conditions, there are other medical problems, or because of their fitness level, a stem cell transplant is not really going to be something that we consider. But either way, in either case, we start with something called induction therapy, where we're aiming to induce a remission or induce a response, as we typically say more commonly in myeloma. And usually that involves a combination of 3 or now possibly 4 drugs. And it's really different the way that we treat myeloma than we treat other cancers. And what I mean by that is, the traditional thought of using very harsh chemotherapy drugs that make people feel very sick, very ill, lose their hair, those kinds of things. Some things that are maybe more outwardly associated with chemotherapy, we don't see that with myeloma. In fact, I often tell patients, if they're fortunate to not have the disease, affect them so much at diagnosis, a lot of people may not even know that they're on treatment. And that can be good and bad because they don't know that what you're going through, which can, be challenging in its own right. So really what we use are a combination of therapies. They can be oral drugs, they can be subcutaneous injections under the skin or infusions. And, one of the newer advances is using immunotherapy in myeloma. And this is a little different than it is in solid organ cancers like lung cancer or melanoma, where immunotherapy is very popular as well. One of the main targets that we go after is something called CD38 on the surface of myeloma cells. And CD38, can be targeted with a type of monoclonal antibody. And there are 2 that are out right now, daratumumab and isatuximab. Daratumumab is actually approved to be used in the frontline setting, meaning at diagnosis. And that has really allowed us to augment the backbone that we've been already using for quite some time in myeloma. Dexamethasone, which is a steroid, is typically employed in all of these cases. And then we use drugs that are in the class of what's called immunomodulatory IMiDs. Chiefly lenalidomide is the main one that we use, an oral drug, and that's been approved since 2006 or so. And then bortezomib, which is something called a proteasome inhibitor, or its cousin carfilzomib, can be used as well in the front line. So we're usually combining these 3 or 4 drugs together in order to create this sort of symphony that really targets the myeloma from many different aspects.
Yeah. How do patients know if they have any of these targets, such as CD38?
So, actually, it's interesting. CD38 is pretty much ubiquitously exposed on the surface and expressed on the surface of myeloma cells. So, it's in a pathology report. It's actually one of the ways in which we can identify what makes a plasma cell a plasma cell. But CD38 is one that is essentially ubiquitously expressed. And I say that with the idea that that expression may go down if you use these drugs to target that specific that target. So, as time goes on, it's not a drug that you may be able to reuse over and over, or at least there might need to be, a nice long break.